Hello, and welcome to Second Opinion. I'm your host, Dr. Ebony Hilton, and I'm so glad you're joining us. When it comes to your health, one voice is never enough. That's why it's always important to get a second opinion, especially when the question feels big, personal, or overwhelming. This show is your safe space to pause, take a breath, and gain clarity on issues affecting your body. Each week, we'll bring you trusted medical experts from across the spectrum of care, from mental health and sexual wellness to infectious diseases, from chronic illnesses to the headlines that are shaping how we live and heal. Together, we'll break down complex information, cut through the noise, and talk honestly about what it means for you and your family. Our goal is simple: to help you stay informed, empowered, and proactive about your health without fear or confusion. So get comfortable, stay curious, and join us as we take a deeper look at the issues that matter most to your well-being. This is Second Opinion. Up first, we're taking a closer look at maternal mortality. According to the World Health Organization, nearly 700 women died during pregnancy or shortly after giving birth in 2024. An even crazier statistic is that for every one death, there are 70 women with complications. Now, if you do that quick math, that's nearly 50,000 mothers a year. That's an unbelievable number, an absolute travesty. In 2025, data hasn't been released yet, but early reports indicate the number will be higher than that, with extremely high rates for Black, Indigenous, and rural women. So joining us now is my favorite OBGYN MFM, is Dr. Rashonda Mitchell, who teaches maternal fetal medicine at the Howard University. Thank you for joining us, Dr. Mitchell.
Thank you so much, Dr. Hilton, for having me. It is such a pleasure and an honor to be here and talk about such an important topic.
Right. So let's jump into it. The number of deaths of women during childbirth or shortly thereafter is alarming, and it's trending upwards since 2023. Can you tell us why? What's happening?
Well, I think, what we saw during the pandemic, we saw a slight uptick in the number of maternal deaths because of the coronavirus. And then shortly after, I believe in 2001 and 2002, we began to see a decrease. So I think we're kind of returning back to our I hate to say it, unfortunate high maternal mortality birth rate in 2023. I think were the last numbers. We do have some numbers in 2024 and 2025 that will be coming out soon. So I think we have just returned back to that baseline of about 12 nationally of per 100,000. Per 100,000 versus possibly, for Black and brown women, it's like twice the amount. So I think that's what we're seeing the increase be attributed to.
And the United States has one of the highest maternal mortality rates among the wealthy nations. So what exactly are we doing wrong here? Is it an access issue? Is it an issue with providers actually hearing patients? What do you think is our number one culprit?
Well, I think it's multifactorial. And it is things that I think you are addressing right now on this show. So, of course, we have to address a problem such as maternal mortality from a policy level. And this is where we make governance that healthcare be provided to all pregnant persons. And then also we have to take the approach to a systemic level. What are we doing at the hospital level to decrease some of these things that impact maternal mortality? So I think other options are advocacy, and we need more advocates to speak up and advocate on patients' behalf. But I think one of the key things that we are missing here is actually putting the patient forward and actually having them advocate for themselves as well as educate women about their bodies in the birthing process, because the total health of America is actually degenerating. More than 50% of childbearing women are overweight or obese, and now we're having to deal with more chronic comorbidities in younger patients. And so I think as a community, we have to really go into the depths of ourselves and begin to cultivate a culture of educating moms or moms to be about pregnancy and some of its complications.
Yeah. You know, it's one of those things. It's a tight and tricky spot to be in, because as a Black woman, what we know is that even at higher education, that we still have higher complications related to pregnancy. That you can have a better, quote unquote, better BMI, a better weight, and still have higher complications than if you were a white patient, correct? And what do you think that's attributed to? You know, as a double certified anesthesiologist, my child was 3 times more likely to die than a white woman with a 3rd grade education. And I'm not saying that should be the case. It shouldn't be a 2-tiered system that if I have more education, my child should be protected. But there seems to still be a 2-tiered system. And the question is, why?
Well, I think that's where we get into the real meat of our story, is that we really have to take a look at our healthcare system and how we provide care and how we train physicians and physicians to be not only physicians, but any obstetric care provider. This is where we do our bias training. This is where we provide compassionate care to the patients, and we listen to the things that are important to them. When they voice their concerns, we should listen. And I know organizations like ACOG, the American College of Obstetricians and Gynecologists. I know that there are a lot of nursing associations. They are also changing the way they train their trainees and coming out so that they can be more active listeners and listen to what patients are saying themselves. So I think on that level, where you start to take out the socioeconomic component of it, it's more we have to look at the systemic, our hospital system and our healthcare system and the way we deliver it. And that is even access to care. And we can talk about that in a little bit more detail.
Yeah. You know, it's one of those things. I want the study to be put out there. There was a study out of Florida that showed that if you had racial concordance, if you were a Black patient and you had a Black OBGYN or a Black pediatrician, that your baby was half, the mortality rate of the likelihood of your child dying was cut in half. And you talk about the bias training. Does that show just how large of an impact that bias can have? That if we just look alike, then my child can live to see their first birthday?
Yes, absolutely. And this is one of those things where I think, because I am at Howard University, so because I'm there, we are a multicultural, very diverse population of not only healthcare providers, but nurses and staff. And so it's kind of hard when you're in that window. But of course, I've trained and I've been in other hospital systems, so I know what it's like to be in those places. But I can tell you, we also have to learn to lean on our own community. I mean, we are in a city where there are 3 hospitals, but some patients would prefer to go to other hospitals instead of coming to a hospital where the providers look like them. And so I think we also have to encourage people to look and seek out a provider. It doesn't matter the color, the race, that are going to listen to them, that they can be honest with, that shows cultural humility. That is a new term that people are utilizing, where it's you take into consideration, I don't know everything about every culture, but I'm willing to learn and listen. And so you want to go to a place and have a provider that has those things. So that is so true with the concordance, that if you happen to receive your care from providers that look like you, you're more likely to have better outcomes.
You know, and saying we need to find providers, they say by the year 2035, we're expected to have a shortage of OBGYNs. The forecast indicates that there will be not enough physicians in the specialty to meet the nation's need by 2037. What are your concerns when you hear this?
Oh, I have major concerns because we're starting to feel the effects now. Unfortunately, due to COVID, a lot of professional OBGYNs and healthcare providers overall, if they were at the end of their career, some of them decided to retire a little early for their own safeties, which is understandable. So there's been a lot of major shifts up the hierarchy of obstetrics and gynecologists. And so right now, a lot of people aren't going into healthcare because of stressful situations such as the pandemic. So that shortage is a real concern as far as training other healthcare providers, such as primary care providers and midwives and physician assistants, to assist in the overall care of this nation. I think is going to be an important component. But let's not forget, we also need to pour more money into the infrastructure of residency programs and hospitals, especially our safety net hospitals, where a lot of those hospitals actually provide residencies to train obstetric OBGYNs. And so I think it has to be a multi-pronged approach if we're going to face what's going on. And not only we have to move toward a preventative healthcare system here in America. If not, we're going to be battling the problems for years to come instead of actually getting in front of it. And I think we have a lot of work to do to work with our public health colleagues so that we can begin to educate our population more about the three major things that kill or that make pregnancies complicated, and that is obesity, diabetes, and cardiovascular disease. And so I think we have to really start pushing for all of those approaches.
Thank you so much, Dr. Mitchell, for joining us today. The patients at Howard University have no clue how blessed they are to have you, because you do save lives every day. You help to save mine. So
yes,
thank you for being here today.
Thank you. My pleasure.
Now, coming up, I'll talk to two lawmakers who have made maternal health a priority on Capitol Hill. You're watching Second Opinion.
They said the quiet part out loud. Black votes are a threat, so they erased them. After the Supreme Court gutted the Voting Rights Act in 2013, Republican legislatures moved fast. New voter ID laws, polling place shutdowns, purges of black voters from the rolls. Trump's Justice Department didn't stop it, they joined in. In 2018, his DOJ backed Ohio's voter purge system, a scheme that disproportionately erased black voters. Their goal, erase black votes and political power. Yeah, that happened. These are the kinds of stories that we cover every day on Roland Martin Unfiltered. Subscribe on YouTube and download the Black Star Network app. Support fact-based independent journalism that centers African Americans and the issues that matter to our community.
Let's bring in Congresswoman Shontel Brown, representing the great state of Ohio, and Congresswoman Nikema Williams, representing the great state of Georgia, to dissect what is happening in legislation to address this crisis. Welcome, ladies. Now, Congresswoman Brown, you are a member of the Black Maternal Health Caucus, the Pro-Choice Caucus, and the Democratic Women's Caucus that has supported comprehensive legislation aimed at lowering maternal mortality rates. What support are you getting from your colleagues in Congress right now?
Well, first of all, I want to thank you for covering this very important topic. We have, and I'm honored to be on with my sister in this struggle, Nikema Williams from Georgia. It is an interesting issue in the district that I represent, because in the 11th district in Ohio, we have first class hospitals with third world infant mortality rates. And so it was very important to be a part of the Black Maternal Health Caucus, because I understand they recognize how important this issue is. As a Congress, we have introduced a momnibus package that includes 13 bills that will invest tools to improve the conditions in underserved areas like the communities that I represent, so we can provide more federal assistance through programs like WIC, and for mothers who are veterans and incarcerated mothers. So I am very encouraged by the work that we are doing around as a Congress to support moms and to try to address the disparities as it relates to infant mortality.
Right. It's such a huge problem. And I don't think people kind of grasp how big it is compared to developed nations. We are struggling in the United States of America. So can you walk us through the NIH Improve Act? It's a bipartisan effort, from what I understand, to secure long-term federal funding.
Sure. So we are looking at, you said it perfectly, we're trying to increase funding. There's not enough resources to address this issue. And then when it comes to our community, I think it's important to highlight that we are impacted sometimes 2-3 times more than our white counterparts. So we need the resources. We need to put the money where the issues are happening the most. And it's important that we have our colleagues understand that this is something that we can address. These are preventable issues, but we have to prioritize them. We have to make the investments. And under this Trump agenda, since they have been very determined to overturn things like Roe v. Wade, it's critical for us in our role, to make sure that we're doing everything that we can to make the investments into our communities. Again, it's just not enough resources, and we have to learn to be able to speak up for ourselves so that our doctors honor what we are telling them. And I know that Representative Williams can speak more to that.
Right. I wanted to ask Congresswoman Williams, you said last year, your quotas are saying Medicaid is the largest payer of maternity care in our country and must be a part of the solution to the maternal crisis. With the 2025 budget cuts to Medicaid, how can we effectively tackle this problem if we're continuously cutting the funds?
So that's just it. We're not going to effectively tackle the problem continuously cutting the funds. We need to be increasing funds. When you look at my home state of Georgia, Black women die more in the state of Georgia than any other state in the country within 1 year of childbirth, even worse than some third world countries. And so that led me to looking at other things like what is impacting this. It's not just the zip code. It's not just if you have insurance or not. So I've introduced the Tech to Save Moms Act so that we can have digital resources available for women in rural communities to make sure that they can address evidence-based digital access to things to reduce the maternal mortality rates. And also looking at things like, how do we get more doctors trained so that they know what to look for? I remember those early days after I gave birth to my son when I literally almost died because of postpartum preeclampsia. And so I introduced the Advancing Maternal Health Equity Act, which is under the Medicaid Act, and it incentivizes states to increase their spending on maternal health services under Medicaid by raising the federal reimbursement rates for states. That means it's money that the federal government will match, not money that has to come from their existing budgets. This is money coming to the states from federal governments to literally save lives. And it's not just impacting Black mamas or Black babies, but this is an American issue that is uniquely American because Black women are dying here at higher rates than in third world countries. And these are policy decisions. And that's why the Momnibus Act is so important, because policy decisions got us here and policy decisions can help us address this cause.
It's something that you bring in preeclampsia, because I also developed preeclampsia after the birth of my twins. And it's one of those things that it really shakes you to know that 1 in 5 women die from pregnancy-related complications across this globe. And we, the two of us, if it had not been for medical intervention, would have been one of those two, women. And it's incredibly disturbing then when you hear senators like the one in Louisiana who said, well, if we just remove Black women from the equation, our maternal mortality really isn't that bad.
As
right?
if we're not a part of the entire American tapestry. Like,
Exactly.
we are Americans. So you don't just erase us and remove us. You address the problems and the root cause. And so that's why these conversations are so important, and bringing out the real stories. So there's not just a number or saying remove the Black women. I like to bring stories like Adriana Smith, who lived in Georgia, and Amber Nicole Thurman, who literally died trying to give birth to their babies.
Right.
These are real stories, real women, real lives that have been impacted.
And I guess the question is for both of you. You know, there's obvious racial disparities that impact Black and brown people, Black and brown women more, right? 3 to 4 times more likely to die. In certain areas, you're 12 times more likely to die in DC. And the question is why? Why do you think? What's the root cause? Is it socioeconomic factors? What are the variables do you think are playing into why mothers are not going home with their babies?
So this is something that I worked on before coming to Congress at the county level. And I want to remind the folks that are watching, it was one of the catalysts for the legislation that was introduced at the county level was what happened with George Floyd. Prior to George Floyd, we had the pandemic that started. So everybody was locked in their homes. They had nothing to do other than to watch TV. And we started seeing the statistics happen right before our eyes of Black people having more negative impacts as it related to COVID. Then we saw what happened with the tragic killing of George Floyd. And so it was an optimum opportunity for us to introduce legislation to declare racism as a public health crisis. Now, we have been doing this work in October of 19, but 2020 was the catalyst for all these things that started to happen right before America's eyes, where they could not look away. They could not deny that Black people were dying at more aggressive rates than our white counterparts. They could not look away at the brutal killing of Breonna Taylor and George Floyd. So racism is a factor in what is happening to us as it relates to our infant and maternal mortality. It is the history of slavery and the stress that we carry in our bodies that makes it difficult for us to carry pregnancies to full term. So it's not socioeconomics. It is not education. It is not even your zip code. It is a genetic predisposed condition that we have as Black women that has been passed down from generation to generation due to how we've been treated in this country. And so, people want to, come up with all of these things, but it is a comprehensive, holistic approach that has to be taken in order to address this issue effectively. And so when we took it on at the county level, we introduced components that had metrics that could measure transportation issues, housing issues, socioeconomic issues, because it's all encompassing. It's not one thing or a silver bullet that we can fix. And that's why you raising this issue is so critically important. And I thank you again for doing it.
Yeah. Many people say that location does matter. I heard you state it doesn't, right? Ohio has the same issues and Georgia has the same issues in South Carolina. And where you live, though, actually does matter, particularly in South Carolina. That's where I'm from, if you can't tell by the accent. But literally half of our counties don't even have a hospital. They don't have a OBGYN in the hospital to give access to persons who are literally carrying the next generation to life. And so
if I may, I just want to clarify. Yes, the access to resources matters. That certainly matters. And that does play a role. But I don't want people to think like if I move into a suburb or, a wealthier community, yes, access is going to be important. But this is something that is specific to us and our bodies is what I meant. But you are absolutely right. Our zip codes can dictate the outcome of our health in so many disparate ways. So yes, but I hope that clarifies my comments.
Oh yeah, for sure. And and you bring up a very important part. What we know is that 80% of all pregnancy related deaths are actually preventable, right? That you can have access, you can be in the hospital and still you can have, unfortunately, deaths. So what do you think we can do? What can be done either through legislation to either improve access, to improve training, to have accountability? What is it that you think is the missing piece in this puzzle?
I mean, I think it's a combination of things. We have to improve access. We have to make sure that doctors are actually listening to patients, because we know that Black women and our concerns are ignored when it comes to many doctors. And we're not always taken seriously when we're talking about the issues that we face. And that's why we have to invest in things like a portion of the Momnibus is the Maternal Education Investment Act, which would create grant programs for maternal and fetal medicine training and residency and fellowship programs for the integration of maternal training into primary care. Because just like in South Carolina, over half of the counties in Georgia don't have an OBGYN. I will always remember Dr. Kenzel, who is down in Southwest Georgia, and she was literally providing services in a Tasty Freeze building just so that women could get access to care. She wasn't an OBGYN. I remember being pregnant with my Carter, and I saw a perinatologist every single week at the end of my pregnancy. Someone in rural Georgia doesn't have access to a perinatologist. And so making sure that if you're going in for that primary care, how can you also have someone trained to at least get you some baseline care so that women are not facing these dire health outcomes? And so there's a number of things that it's going to take to address this. And we've got a lot of work to do. But that's why I'm so glad to have a co-conspirator for justice like my sister in service, Chantel Brown, who is working on this issue, and people like you who are practitioners bringing this up and making sure that it's not just on the back burner. And we're continuing to highlight the needs and what women are still facing today in 2026. We're still facing these health outcomes that seem like something from a day past.
Right. And you know, that day past, our statistics are matching pre-Civil War numbers when it comes to Black women and their maternity and mortality. So what can voters do? You know, you two are in great positions of power, and in the hospital, I'm in a great position of power. And oftentimes it leaves the person feeling, what can I do? Right. So what can voters do to ensure legislation gets passed to improve maternal health care? Is there anything they can use besides their vote?
Absolutely. They can call our offices. They can call their senators. I know my sister is a lot like me. Well, she's very blessed right now. She has two senators that will actually listen. I am in the great state of Ohio, where our senators need a little bit more encouragement. So I would encourage you to contact them to share this information far and wide with your friends, your neighbors, your family, so we can talk about it and so that people can be more aware. I think the fact that we have the ability to share the information, but we sometimes are shy about speaking up. We have to stay informed and we have to speak up. That is how we address these challenges. If you are in a position where you are actually experiencing some of these disparities or experiencing some of these issues as it relates to the care that you're getting, get a second opinion if your provider is not, if you don't feel like you're being heard by your provider, if you have the privilege to do so. But it also, I would be remiss if I did not remind folks, it is a direct impact of the big ugly law that was passed last summer, how these programs are being dismantled in HHS and having cuts to things that DEI programs where we may have had advocators on our behalf. So we have to be our own advocates and ambassadors in these spaces and support each other so that we can push back on the policies that are creating harm and continue to remind people to stay civically engaged so that, as Nakima said, as Congresswoman Williams said, that we can get policies back on the books to reverse course of the policies that are doing harm to us.
Well, that was empowering. I just want to thank you both, Representative Rounds and Williams. We appreciate your joining us to discuss this very important issue today, and we hope to see you soon on the Stomping Grounds.
Thank you, ladies.
Thank you.
And when we come back, he's making sure his wife's death was not in vain. Charles Johnson became a maternal health activist after his wife, Kira, tragically died hours after giving birth to their second child.
Hey y'all, welcome to The Other Side of Change, only on the Black Star Network and hosted by myself, Bria Baker, and my good sis, Jamira Burley. We are just two millennial women tackling everything at the intersection of politics, gender, and pop culture.
And we don't just settle for commentary. This is about solution-driven dialogue to get us to the world as it could be and not just as it is.
Watch us on the Black Star Network, so tune in to The Other Side of Change.
We've heard the numbers, the startling statistics and data, but let's hear directly from a family that has experienced this devastating loss. Joining me now is Charles Johnson. Charles, the son of TV Judge Hatchett, lost his wife, Kira Johnson, in 2016. She passed away in the hospital just hours after having their youngest son, Langston, during a routine C-section. Kira died from internal bleeding that went untreated for hours and pleas for help that were never answered. Welcome, Charles.
Thank you so much for having me, Dr. Hill. It's wonderful to be here with you.
Yeah, I send my deepest condolences. I think we all identify with Kira and identify with you. I practiced medicine for 18 years, and hearing stories like yours still shake me to my core because they should never happen. And it's been a decade since that tragic day. We know that each day you're fighting for our honor, so we thank you for joining us to tell us her story.
Absolutely. I'm so proud to be here with you this morning.
Yeah. For those who don't know your story, can you share a little bit about Kira's pregnancy and what happened once she delivered?
Sure. So absolutely. So, when we talk about Kira, we're talking about a woman that was sunshine personified. We're talking about a woman that raced marathons. She had her pilot's license, was a skydiver. Throughout her entire pregnancy, she was in excellent health. And all signs pointed to both Kira and our new baby Langston being extremely healthy. And so we went into Cedars-Sinai Medical Center on April 12th of 2016, where we expected to be the happiest day of our lives and walked right into a nightmare. We went in for what was supposed to be a scheduled cesarean section. Baby was born perfectly healthy. And after we got back to recovery, which is typical in a cesarean delivery, that's when things took a turn for the worse. I actually noticed blood in Kira's Foley catheter. I brought it to the attention of the doctors and the nurses at Cedars-Sinai. This is around 4:00. And they ordered a series of tests, including a blood work and a CT scan or CAT scan that was supposed to be performed stat. And to me, that meant immediately. And at this point, I'm concerned, but I'm thinking, my wife is healthy, my baby is healthy, and we're at what is supposed to be one of the best hospitals in the country. And so 4:00, 5:00 came, still no CT scan. I began to ask, where's the scan? And, it's coming, it's coming, it's coming. 5:00 came, 6:00 came, and the hours continued to go by. And for the interest of time for your listeners, Kira was allowed to bleed for more than 10 hours. They didn't finally take her back to surgery until after midnight. My son was delivered at 2:00. And for those 10 hours, I begged and pled for them to just validate her pain and prioritize her. And my pleas for help fell on deaf ears. And when they finally took her back to surgery, they opened her up, Dr. Hilton, and there were 3.5 liters of blood in her abdomen from where she had been allowed to bleed internally for all those hours. When we look back at her medical records, it says that she was declared a medical emergency, a surgical emergency at 6:45 p.m. And they didn't take her back to surgery until after midnight. When they took her back for that surgery, her heart stopped immediately. And so when I walked into that hospital that afternoon, the thought that my wife would not walk out to raise her sons, it never crossed my mind. But as you know, and as everybody here under the sound of our voices understand now, that we're in the midst of a maternal mortality crisis in this country, and it's shameful. And we refuse to continue to let this happen to other families.
Yeah, that story is chilling, and it should have never happened. You started a movement for Kira for Moms, an organization fighting for Black maternal health. What have you seen in her honor? What have you seen as the biggest challenge, and what progress are you seeing at this point?
Excellent question. So I want to level set this conversation by saying this. I would not be here if I did not believe with every fiber in my being that we can fix it, right? Right now, as you mentioned in the previous segment, 84% of the mothers that we are losing are considered preventable, right? And so we understand that these are mothers that should be going home with their children. They should be there at the first day of kindergarten. They should be screaming at the top of their lungs on Saturday mornings, and they're being taken from us. And so what I have seen is a tremendous growth in first of all, the awareness, right? Because for far too long, this was America's dirty little secret. We are seeing tremendous movement like we had never seen before from legislative efforts. So a huge shout out to Representative Nikema Williams, who I know was on with you just before me, Representative Williams. And we have these amazing leaders in Congress who are championing these issues. We're seeing corporate stakeholders come to table. We're seeing medical bodies like ACOG and nurses and midwives taking accountability for what they need to do to address this. And so I'm really proud of the progress we have made. And we're also making tremendous strides in educating the public about awareness, right? Because informed families are able to make better decisions about what, who, when, and where is the best birthing experience for them that will give them the best experience, not just to survive. Survival is not the threshold. We want families to be able to thrive.
Right. This epidemic has impacted dads and husbands across the board. So how, these organizations are really great in targeting the moms, but
Yes.
How are we rallying to support the men? Are there any organizations that you know of?
Yeah, absolutely. And thank you so much for bringing that up, because here's what I want to say is that the dads are not coming, the dads are here. And you're absolutely right. There's a tremendous amount of emphasis on mothers and babies, as there should be. But what we find is that the very important component of this conversation that's being left out is the role that fathers and non-birthing parents can play in improving maternal health outcomes. So we actually at 4Cure for Moms have actually specifically launched 4Cure for Dads. And it's a program specifically for that, to empower fathers to understand how to show up, how to understand how to advocate, how to understand how to support. And so we've developed a free online app. You can go to the App Store now. You can go to the App Store now and download it. And it walks fathers and non-birthing parents through the entire fatherhood journey, from preconception. How do we understand our own health and how that informs the birth of our child? How do we understand the difference between a doula, a midwife, and an OB, and what choices are right for our family? How do we understand developmental milestones? How do we support our partner throughout pregnancy and after pregnancy? Very importantly, after that baby comes home, how do we look out for things like pre and post eclampsia? How do we support postpartum depression? How do we look for what are those very, very important post-birth warning signs that are red flags? And we can make sure that mom gets this help and support that she needs. So we believe that a huge part of improving maternal health outcomes and doing it quickly is empowering a generation of fathers and non-birthing parents on how they can step up and be a critical part of that care team.
What is in the next stage of the fight, the foundation? What do you plan to do next? What is the next greatest thing that can honor the memory of Kira? Yeah,
so I want to see sweeping legislation passed on the federal level. There's a bill I know that you're familiar with, and some of your listeners may be familiar with, called the Maternal Health Momnibus, a package of 13 bills, including the Keir Johnson Act, that will go a long way to putting a very important foundation of infrastructure and set of criteria around maternal health in this country. I really, truly believe that every single family in this country deserves a safe, dignified birthing experience of their choice. And I want to make sure that these birthing experiences are adequately paid for. And then we're going to take it a step further, and we're going to make sure that families across the board have paid leave so that they can have that very important time with their baby when the baby comes home. And so, like I said, I believe that sooner than later, all these things that we're talking about with maternal mortality and these devastating stories that we're hearing, we'll be able to talk about them in the historical context, because, like I said, I want people to understand that although these statistics and these stories are heartbreaking, we know what needs to be done. It's up to us as a collective to make sure that we apply pressure to make sure that our country prioritizes the safety and well-being of mothers and babies.
Well, we thank you so much for sharing your personal story and for applying that pressure. One thing is for sure, your voice and Kira's life have literally helped to save hundreds of thousands of women's life across the board. So we thank you.
Thank you so much. I appreciate it.
And coming up next, the deadly flu virus is on the rise, and one doctor says it's old school tactics that are actually going to save us all. We'll be right back.
At the end of the Selma to Montgomery March in 1965, Dr. King stood in front of the Alabama State House and told 25,000 Americans that the greatest threat to the greedy oligarchy is when poor blacks and poor whites and others mobilize together and form a voting bloc that can fundamentally shift the economic architecture of our nation. In America today, we have fewer voting right protections than we did when the Voting Rights Act was passed in 1965. And state legislatures have abused their power to try to pick their voters rather than let the voters pick their legislators. Meanwhile, every day people are suffering while the greedy get richer and richer. Dr. King was right, and many others were right. The billionaires who think they can buy our politicians are afraid of people coming together across dividing lines and building power together. In 2013 and 2014, we together in this state built out the Moral Monday movement. And in 2014, more than 80,000 people showed up in Raleigh for a mass people's assembly. We mobilized our power. We mobilized our vision. We did not continue to just resist what others were doing. We claimed the world that we wanted, the society that we wanted. And what we did energized. It was not partisan, it was principled. Here we are again now in 2026, and it's time to love forward together and mobilize. This is our Selma moment, and we need everybody, regardless of your race, your creed, your color, your religion, your sexuality, whoever you are. If you love voting rights for all, if you love abolishing poverty and bringing into reality living wage, if you love health care for all, if you love and grace and mercy and do not want to buy into the religious nationalism of hate and meanness and a lack of empathy, if you want to love forward together, welcoming immigrants rather than suffering ICE raids, if you love the environment and want to see it cared for rather than the polluters taking over, if you love fully supported public education, if you want to love, not hate, and to have peace and not war, to stand against unchecked militarization and the militarization of our cities, then it is time to come together and mobilize our power and our passion for justice. Then we now are in a moment where we must move from resistance to loving forward and mobilizing our power. So, from February 11th through the 14th, North Carolinians are going to be walking and marching and caravanning from Wilson to Raleigh. And on Saturday, February 14th, Valentine's Day, we will hold a massive people's assembly for a moral agenda in Raleigh, North Carolina, saying it is time to love forward together. We are marching from a district that MAGA extremists, because of a call from President Trump, decided to gerrymander the 1st Congressional District, take it away from the people. And we are inviting all defenders of democracy and champions of the common good to meet us in Raleigh on February 14th to reclaim a moral agenda, an agenda for going forward, to pursue the society and the democracy that we want, not only for ourselves, but for our children's children. For somebody's been hurting our people, and it's gone on far too long, and we won't be quiet anymore. We will love forward together.
The severe flu season is taking a toll on the United States. We're seeing an uptick in cases across the country, from California, where 2 adults have already died from the flu in San Francisco, to New Jersey, where a 2-year-old has died. There's estimated 19 million illnesses at this point, 250,000 hospitalizations, and 10,000 deaths this season. Joining me now is former CDC senior health scientist, Dr. Henrietta Ross. She holds a PhD in epidemiology and has served as a public health researcher and analyst for nearly a decade. Welcome, Dr. Ross.
Thank you.
You know, this flu season has been quite severe. You know, is there any reason why, Dr. Ross, why we're seeing that we have this swing in cases this early within this the flu season? Is it because of the strain? What is leading to this being the case?
So it is. It's because of the strand. So we have it's a H3N2 strand, influenza virus strand, and this strand is coming to dominance. It's called subclade K. So previously, it hasn't been the dominant strand, and so for the influenza vaccine, we use what we've seen previously, and because of the mutations, our body just does not recognize the immunity to be able to fight it off as it would previous seasons.
And who is at the highest risk of complications if they were to catch this bug?
So those with chronic illnesses like heart disease, diabetes, those who are older, our older individuals like 65 years and older, and even our younger kids, those who are 5 and under, most especially those who are 2 years and younger. Also those who are pregnant women, and those are the ones that are more likely to experience severe illness, as well as those who are immunocompromised, those who are suffering from like cancer or HIV, where their immune system is lower. Those are the ones who are experiencing more severe illness with this particular strand of the flu.
Right. You know, and how is this flu season interacting with COVID-19? You know, we just got through, I don't know if we got through the pandemic or the pandemic is actually still present, but how is it interacting with COVID-19 and RSV in terms of co-infections and hospital burdens that we're seeing across this country?
Right. So the thing to remember is we're in the respiratory virus season. So it's not only just the flu. We have COVID-19 as well, and then we have RSV as well. So there are cases that are presented with co-infection where people have COVID as well as they have the flu. But it's less than about 5% of those who are presenting with both. They call it the double whammy when you have two of the three. But in those over 200,000 people who have been hospitalized, only about 5% are presented with co-infection.
You know, and I know current day, we have this administration and the Make America Healthy Again activists who are saying you should not get the vaccine, right? And it's been this huge debate. But what are the current recommendations for the flu vaccine? Like who should get it? And when is the best time to get vaccinated?
Okay, we all should get it. 6 months old up. Everyone should get the virus. Ideally, should get the vaccination. Ideally, you would want to get the vaccination September, October at the onset, at the start of our respiratory virus season. But if you have not gotten it, you want to get it as soon as possible. Because it takes about 10 days to about 2 weeks for your body to build up an immunoresponse to the virus.
Mm-hmm. And, you know, it's one of those things you said 6 months. I have 7-month-old twins now. And for the viewing audience, I did get their vaccinations at 6 months. They have 2 doses that they have to get, one at 6 months and then come in 4 weeks later to get the second dose.
Yes.
So I'm not a hypocrite. I want to protect my children. So, you know, what are the stages of symptoms that should prompt someone, if they do get the infection, to stay at home or testing and seeking medical care?
So if you get a fever, so the symptoms for the flu are high fever, body aches, the fatigue to where you feel like you've been ran over by a truck, chills, cough. If you are experiencing that, I would suggest that you stay at home. You can actually test for it. You can test with much like a COVID test. They have flu tests that you can purchase over the counter and you can test for those. Asking that you please stay at home because, of course, it's highly contagious. And so you want to keep everyone around you safe and flu free. But if you are experiencing severe symptoms where you cannot breathe, shortness of breath, asking that you please go to the hospital. Severe pain in the chest or stomach, please go to the hospital.
And what can we do to protect ourselves? Is there anything we can do to avoid getting infected by this?
Sure. We have to take it back old school. We have to wash our hands. Wash your hands. Wash your hands for at least 20 seconds. Get it in between the fingers, underneath the nails. If you are feeling sick, please stay at home. And for those who are immunocompromised, for those who have chronic illnesses, wear a mask if you're going out. If you're going out amongst a crowd of people, then wear a mask to prevent actually contracting the flu virus.
And if you're one of those high-risk patients, or even if you find yourself having a severe case of the flu, are there any antivirals that can be taken that they can help to reduce the symptoms and the duration of the illness itself?
Absolutely. You can take Tamiflu. So Tamiflu shortens the illness by 1 to 2 days. And it also helps with the symptoms as well. And it helps with the viral shedding, because it's during the viral shedding period that you're most contagious and that you pass it on to others. So by all means, yes, go to your healthcare provider and get that Tamiflu.
Yeah. It's one of those things I think people don't go and seek help once they get the infection. If you're within that first day or two, that first 48 hours, getting the Tamiflu in your system, or Xofluza is also a medication that you can take. The Tamiflu is 2 pills for 5 days. Xofluza is 1 pill, right? Yes. Getting those medications as early on in your disease process as possible is key, because that can help to stop the replication of the virus and keep your symptoms at bay.
Absolutely.
Thank you, Dr. Ross, for coming to speak with us on this very heavy, very current topic of the flu. And, we appreciate your expertise, and keep up the fight, because we need people like you in to combat this vaccine, anti-vaccine movement that we have going on current day.
Thank you, Dr.
Thank you. And still to come on Second Opinion, we'll talk about the importance of movement as you get older. We'll be right back.
Violent white supremacy is, quote, the most persistent and lethal threat in the homeland.
The greatest terrorist threat to the homeland is the homegrown violence stream, including hate crime committed on behalf of some kind of white supremacist ideology.
They are coming after everything in Black America. MAGA and Donald Trump are specifically targeting Black America. They are going after the money. Attack Black Lives Matter. Attack critical race theory, attack woke, DEI. MAGA wants to defund Black America. This is a perfect example of their desire to completely degrade and de-emphasize Black people.
Okay, for all of my seasoned viewers, we've got something for you. We're trying to keep you moving, keep you active, keep you healthy, and keep you feeling young. Now, joining me is Ms. Sheryl Grant, the CEO of Join Fit for Life. Sheryl is a fitness and transformation leader, and at a young age of 64, she is killing it on Instagram. So welcome, Ms. Sheryl.
Thank you, thank you, thank you. So glad to be with you today.
I mean, you are absolutely incredible. So let's just jump right in. Your videos are amazing, and they're helping seniors and younger people alike stay fit at any age. So for one, why is fitness for those over the age of 60 so important to you?
I believe that when we start to, especially at this particular age, the ripe age of 64, we tend to look at fitness as something to do versus something that's a gift for us to have in our lives. And fitness truly is the elixir to youth. And I am not only an example in living the life, but for everyone who really gets into this fitness game, really understands that it is what's going to sustain you in living a positive life, especially as we age, and you want to be as healthy, have the ability to move around as much as you can, and just truly, truly age gracefully, like I believe that God designed us to do.
You know, I'm pretty sure that all the listeners said, wait, she is what, 64? 64. Yes. And, you know, you earned the title of Miss Olympia at age, is it 57?
55. I earned at the age of 55. And Dr. Ebony Hilton, let me tell you, this journey for me was, when I got into it, it really wasn't about how I looked. It was about truly reconnecting with my body. And after we age, we tend to disconnect in so many different ways. We tend to disconnect mentally, emotionally, spiritually. And the thing that I learned on this journey of fitness is, how do we reconnect to our bodies, both mind, body, and spirit? And fitness is a way to do that. It's more than just lifting. We, at the age, after you turn 40, you literally are losing 2 to 3% of muscle mass every year. Your body is truly starting to shrink. In addition to that, with all the other stresses that we have in life, look at the world outside of us. It's crazy outside. We already know it's on fire, and nobody needs to tell us that the world's on fire. The world's on fire. The question is, what are we doing to sustain ourselves during this thing that's happening outside the world, let alone that's happening? We as individuals, we're dealing with, either at this particular point in time, aging parents, we're dealing with grandkids, we're dealing with our own elements as we age, going through hormonal balances, hot flashes, all the other things. What are we doing to sustain ourselves? And that really is what I am about and what my journey is about. How do I teach women to reconnect, and men, and it really applies to everybody? How do you reconnect with your body and get back into alignment so that you can age again gracefully and beautifully and be the best? It's all about living our most optimal life. Nothing is ever guaranteed to us. Nothing is promised to us. But the thing is, what are you doing about it? What are you doing? Making the excuses of I can or I can't. Either way, you're right. If you say you can't, then no one can argue that point with you. But it really is a mental game just as much as it is a physical game.
Wow. And you know, you brought up an interesting point. You said we lose 2 to 3% of our body muscle mass.
Yes.
What are the health implications of that alone? Why, when people hear that, should it not spark their ears to say, hey, that's a dangerous thing in a position to be in?
Well, as we age, our muscles become brittle, and we don't want osteoporosis, or we don't want the point of you fall or something, and our healing takes a lot longer than those that when we're in our youth. So how do you heal? So when I talk about muscle mass, I'm talking about your ability to walk. I'm talking about your ability to reach. I'm talking about your ability to bend over. I'm talking about what kind of quality of life do you want? And muscle mass is just one of the many things. There's so many different things that is attacking our body going through this. There is your metabolism. It starts to slow down. You're not burning as much body fat as you would when you were younger. There is not only your muscle mass, you're tired. There is your energy level. There's so many different things that are impacting us as we get older. And when we start to work out, and this particularly heavy lifting is everything that you do. I am a proponent of working out. I don't care what you do something, move. Anything is better than staying stagnant. So whether your vice or tool, find it. If it's walking, walk. If it's doing Pilates, do Pilates. Everybody has a different vice, but you need to find whatever works for you and make sure that you maintain it. Consistency is everything in everything that we do. It's not a one-time hit or miss. It's truly about you developing a practice, a way of living. It's a lifestyle, just like getting up, brushing your teeth. You don't have to think about it. Fitness needs to be that way in our life too. And not only are you talking about osteoporosis, you're dealing with other things from eating foods that are not nourishing your body, high blood pressure. You're talking about heart disease. You're talking about all the different ailments that have starting to come on at an older age because we didn't take care of ourselves at a younger age. So it's very important, no matter where you are. I'm 64, but whether you're in your 20s or your 30s or your 40s, it doesn't matter. You're headed in this direction. The earlier you start, the better. But just because you're 60 doesn't mean that it's over for you. It's a decision. It's a choice. And you have to decide, or I challenge you to decide, what is it that you want in your life? So that's where it needs to start.
And you bring up such an important part about how self-care, it really is a necessity and giving you longevity of life. But oftentimes we do, as women, we are juggling multiple hats, right? We're taking care of everyone else but ourselves. But you've been quoted as saying that you are leading women back to themselves. Yeah. What do you mean by that? And what is this holistic approach that you speak of in your book? I think it's the acronym FIT.
Yes, FIT. Great point. And thank you for asking, because I didn't start the story telling you about myself. So you kind of did a little bit in terms of introducing me, but I didn't get on this fitness journey to look good. I really did it to re-engage with myself. I was working in corporate America where I was challenged at every single level. I was in the top 1% of the company. And I was always told, Sheryl, keep your head down, do a good job, and you'll get the reward. Well, the reward never came. And what I found with most women, they look at it as a glass ceiling. For me, I looked at it as a brick ceiling. And how do you penetrate that brick ceiling? And I got to the point where I was dealing with anxiety. I was dealing with depression. I was dealing with all kind of different things in my life. And I decided to go on this journey to truly transform my life. But what I learned, I transformed my body. But what I learned is I transformed my mind. And I came up with something called the Connect Dot system. This is where I lead women back to themselves. The system is a proven methodology in terms of how you become the best version of you. Now, FIT for me stands for faith, the ability to believe in yourself, the ability to understand what your why is, intuition, learning and to tap into that small voice that's always talking to you and to lead with it. And tenacity is your ability to push through even when it gets hard, even when it's not easy. And you take that, and once you are able to, I won't say master, but you become better at being able to manage that. I came up with the C4 matrix because that's where you sustain it. And the C4 matrix is simple, but it's very powerful. The first C is communication. How do you communicate to yourself? What do you tell yourself? Do you tell yourself you can or you can't? What is the talk that you have with yourself? You're not good enough. You're never going to have it. That talking has to change. And that's the communication. And not only how you communicate to yourself, but how you communicate to others. Then is connection. Connection is the piece that pulls it together. Connection to yourself. Are you listening to yourself? Are you listening to that voice? So there's communication, connection, and then there is community, collaboration. And that's what we're doing here today, Dr. Ebony. We are building collaboration. We're building together to share a story, to inspire others. And the biggest C in the C4 matrix is community. When you have community, you can do everything. And that's where the hidden C change happens. So leading women back to themselves is really grounding you first in your mind. When I can ground you in your mind, then I can lead you to your North Star. Your North Star is always going to be the thing that's going to lead you when you don't feel like getting up. Because I'm not going to tell you it's easy, but what I will tell you, it's worth it. And it's like getting on a bicycle. When you first do it, it's hard. But once you start doing it, you will develop the patterns. But the thing is, you have to stay stay consistent. And that's where this Connect Dot system comes in play to help you be accountable. Because for me, just to tell you to do this is one thing, but for you to be in community with people that are like you, that are speaking the same language as you, that's on the same journey as you, to be the best version of you, that's where it really gets the meat of it, where you start to see yourself. And when you see yourself transform, there is something so amazing when that happens. It's like a light that goes on in you. It's like the little girl or the little boy in you wakens again, and you remember who you are.
Right. You know, you bring up an excellent point on being consistent, right? And I think the intimidating factor, I'm not a gym girly. Like, I've never seen myself in the gym. So when I do go into the gym, I feel completely out of place. I don't know if I'm looking awkward on this machine. I don't know if I'm doing this correctly. And I think that may be one of the things that hinders people from actually becoming gym girly. So if you're going to give any suggestions as to 3 core exercises that we can start out with to start to get our feet underneath us, if you will, what would those workouts be for all women and men alike if they want to stay fit over the age of 60?
So the first thing I would say is starting out with doing squats, working on your legs. Your legs are what helps you to stay strong. And it helps you not only, your legs help you with your core, which would be the second thing that I would talk about. So squats, doing pull-ups, doing push-ups, making sure that you are doing some form of cardio, but I would never not cardio alone and not just stagnant cardio. What I would recommend you do is get on a treadmill, put it at a 7 incline, and walk with no hands at a speed of 2 or 3. That will allow you to build the strength in your legs. Doing sit-ups will help you with your core. The thing about working your body is about being consistent and working your body at least 2 to 3 days a week, making sure that you're spending at least 30 to 40 minutes in the gym. One of the things that you said, which is really valuable, is how do you stay consistent when you go to the gym? I want to tell you, this is not as complicated as we often want to make it. It's really about a decision. And one of the things I do is I have a boot camp and a program that I have where you can do it from your home. You don't have to leave. This doesn't have to be complicated. What it means is about consistency. If you're a person that doesn't necessarily like the gym, or you just feel out of sorts when you get in, you don't know exactly what to do, one of the things I want to say to you, the first thing is start at home. Start doing sit-ups at home. And it's as easy. You're watching television. You're not doing anything. In that moment is the best time. In addition to that, we have more time in the day than we think. We often think, like, I know I'm a busy person and I understand what it means to be in corporate America and to be a mother and to raise your children and to try to do all the different things that we need to do in the course of 8 hours. It's like, how do I find time? I want to say that making time is the priority, because you are your star player. You taking care of you is everything. You cannot pour from an empty cup. We walk around in life being nurturers and giving to everybody. And I want to say the greatest value you can ever do is give to yourself. There's no excuses for not being able to take 10 minutes out. Whether you're a morning person like myself, I'm up at 3:30 in the morning. My first class I teach is at 5 a.m. in the morning, and it's a 45-minute class. But I make a commitment, and my commitment is to not only the people's lives that I want to transform. And I have a goal, by the way, Dr. Ebony. I want to reach 100 million people. I know that's a lofty goal, and I know I'm pretty audacious in saying it, but I feel like if God gave it to me, then I can bring it to fruition. And it's really replanting these seeds to remind people, if I'm 64 and can do it, so can you. I started this journey my son was 3 months old. My oldest is 38. My youngest is 33. I have a granddaughter, 5. I started this journey over 38 years ago, and I've been competitively training for over 10 years. And there's truly a difference between working out and competitive training. And I want to tell you, you can work out. You can do this. It's a decision. It's a mind decision. What are you deciding to do for you? And I'd rather for you to be working out now than to have to or be forced to because of health issues. And we already know this system is not set up to support us. The system that's in place right now is set up to make us sick. If you didn't know that, every time you go to the doctor, the first thing that they want to prescribe you is a pill. Too often I've gone and they want to prescribe me a pill And I want to tell you, half the things that most people are dealing with can be changed just by changing your diet, just by changing your nutritional habits. What is it that you're putting in your body? And are you willing to make the commitment? I'm here to tell you again, I can't say it enough to you. If I'm 64 and can do it, so can you. I am the example. I am living the life. I'm not telling you what somebody told you. I'm telling you what I live every single day. And I can tell you how it's transformed my life, not only in the way that I show up in the world, but in my finances, in my relationships, how I move in the world, because my commitment is to taking care of myself first, and then I can take care of others. I hope that answered your question. I know I was all over the map, Dr. Ebony.
No, that was you have motivated me. You mentioned you can't pour from an empty cup, and that resonated. I just thank you so much for your inspiration. Like, I feel like you preached a word straight to my soul. And I know that you motivated others that are listening right now to prioritize themselves. Because as you say, we can't show up for others if we don't show up for ourselves. So I thank you for that.
You're welcome. You're welcome. And thank you too for having me on your platform. And I want to invite your listeners, if it's okay with you, to one, you can follow me on IG or any of the social media platforms. My name again is Sheryl, Sheryl Grant, Grant. I also want to let you know I have a boot camp. And if you don't know where to start with me. I'm here, and I'm 64. So I understand the aches and the pains. We do have them. Let's be real. At 64, your body starts to change. Things start to change. Hormonally, things start to change. And so I'm here to be a support to you. But the thing I want to encourage you with, if you don't do any of those other things that I just mentioned, you are the only person that you have, and taking care of yourself is everything. If you don't do it now, life will show up and you'll be forced to. So prioritize yourself. Take a walk, drink your water, hydrate, and know that when you do these things, you're not only telling God thank you, but you're showing him by taking care of yourself.
Well, I know you say you want to reach 100,000, but I think 1 million people.
100 million. I said it.
You said 1 million? Oh, well, like I said,
100
million. I think beyond that, I think everyone in the United States, is 300 million of us, needs to be listening to this word. So I thank you for being here, and we will definitely have you back soon.
Okay, thank you. God bless, and thank you for having me.
God bless. When we come back, I'll have my prescription of the week, so stay with us.
On a next, A Balanced Life, we talk about how to get in touch with your feelings, emotions, how to find your North Star, and how to move your life along.
Because oftentimes what we'll do is we'll accept what the world says about us as the truth and how we see ourselves, which that could be completely contrary to what the Word of God says about who you are.
That's on a next, A Balanced Life, here on Black Star Network.
If you've seen soft life all over your feed, it's not about being spoiled. It's about finally exhaling. We come from a culture that taught us to be strong no matter what, but strength doesn't have to mean suffering. For a long time, many of us learned that rest had to be earned, that peace came after the burnout, that being exhausted meant you were doing life right, work twice as hard to get half as much right. But science tells a different story. Chronic stress isn't just in your head. It lives, it festers within your body. It raises your blood pressure. It tightens your blood vessels. It disrupts your sleep. It literally weakens your immune system. And over time, stress increases the risk of heart disease, diabetes, depression, and even cancer and memory loss. Your body stays in fight or flight. And when that switch never turns off, well, healing can't turn on. And the impact isn't equal. We know that for Black people, high blood pressure shows up earlier in life in our community, and that higher rates, often in people still in their 30s and 40s. That's not normal. Heart disease and stroke also strike years younger than they do in white populations, and deaths from heart disease run about 35% higher than the national average. Diabetes, same, is diagnosed more often and at younger ages, up to 60% more likely, setting the stage for earlier heart attacks, strokes, and kidney disease. These aren't just numbers. They're the physical cost of living in a constant state of pressure. So when people talk about the soft life, it's not about luxury. It's literally about lowering your cortisol. It's about giving your nervous system a break. It's about letting your heart beat without racing. Soft life doesn't mean you stop showing up. It means you stop destroying yourself in the process. It's choosing to protect your health. It's drinking your water and taking a walk. It's turning on music and actually enjoying the drive. It's saying no without guilt. It's letting your shoulders drop. Your body is not a machine. It's a living partner in everything you do. And it's been carrying stress, pressure, and survival for generations. Choosing softness is choosing to heal what ground culture never addressed. You don't lose your edge by resting. You sharpen it. You don't fall behind by slowing down. You realign. Soft life is not quitting. It's regulating. It's restoring. It's honoring yourself. And healing, that's not lazy. That's powerful. And that, my friends, is my prescription of the week. Thank you all for watching, and we will see you next week on Second Opinion.